Namaste to all, and welcome to yet another session of Easy Ayurveda Gurukula. Our guest speaker, Dr. Rajnikant Patel, is with us. Welcome to our entire family of Easy Ayurveda who have joined here, and even the new members who have joined for today's session. And Dr. Rajnikant will be presenting on osteomyelitis and its Ayurveda management. So, a quick introduction of our guest. Speaker today, Dr. Rajnikant Patel, his Chief Ayurveda Consultant, Agnivesh Ayurveda Hospital, Surat, Gujarat. The photograph of our guest speaker. So anyhow, we'll be catching him live in this session. Academic profile, he completes his BMS degree, Ayurveda degree from Athreya Ayurvedic Medical College, Bengaluru. Coming to his professional experience, has 7 years of clinical practice in Ayurveda. So he's Chief Ayurveda Consultant at Agnivesh Ayurveda Hospital, as I already said, in Gujarat. It's a 10-bedded hospital with, so he has treated many complicated cases, mainly during the COVID time, the mucormycosis or the black fungus cases in India. So many local and national news channels and also media have covered the news and success stories of Dr. Rajnikant. That includes the BBC News as well. So he's very much interested and inclined towards handling critical patients in ICU, neurodegenerative diseases, cardiac patients, cancer cases, and some clinical emergencies. So, and he has got very good success in handling very complicated cases. He strongly advocates and practices Ayurveda medicine and treatments. Dr. Rajnikant also prepares medicines all by himself and also collects herbs as and when needed for preparation of medicines and also guides the patients therein. So he's been invited as a guest speaker by many colleges and forums as a guest speaker, expert speaker, including, as I already said, Easy Ayurveda Gurupala sessions. Also, he has given a few very interesting topics as presentation. He is also in our Easy Ayurveda panel of consultants. So today's topic will be osteomyelitis and its Ayurveda management with case studies and successful case studies.
Okay, so today's topic is a clinical review on osteomyelitis and its Ayurvedic management. With that, I will be sharing two interesting case which were successfully managed with Ayurvedic medicine. Whenever question comes in our mind that or when the patient comes with osteomyelitis, we directly refer this patient to either orthopedic surgeon or in a higher center, thinking that in Ayurveda we cannot manage this type of disease, as this is a little bit hard to manage this kind of disease. We should always respect our Samhita and Shastra. There is no disease in the world. I am repeating, there is no disease in the world that cannot be treated or managed by Ayurvedic medicine. So same applies to osteomyelitis. Because the thousands of years of human observation and trial and error are far more better than 6 months of rat experiments in the lab, which nowadays modern science are doing. They will do some study on some mice or some rabbit or some human trials. They will take maybe 100, 200, 1000, 2000 patients, and they will come with conclusion and they will apply to the whole public. In case of Ayurveda, it is not like that. It was observed on thousands and lakhs of patients, and after having observation and trial and error, our Acharya has written the Samhita. So without doubt or without any question or without any confusion in Samhita, we must respect our Samhita and we should apply that knowledge which is written in our classical text to the patient. So same, osteomyelitis can be easily treated with Ayurvedic treatment. So I hope after this presentation, nobody should refer this case to higher center. Instead, they should treat with this Ayurvedic medicine. So this is my hospital, and we are dealing with all this department. So coming to the brief introduction or definition, the osteomyelitis, as we all know, it is a bone infection that might be caused either due to bacteria or due to fungus or any other germs. In most of the cases, bacteria will be the main culprit. In rare cases, fungus will be causing the osteomyelitis. The osteomyelitis, which is seen in mucormycosis, we all know mucormycosis is caused due to this aspergillus fungus and mucor spore fungus. So these are due to the fungus, and majority of the time, bacteria is the main cause for this osteomyelitis. So osteomyelitis or the bone infection is most oftenly caused by bacteria, but it can be also caused by fungus or any other germs, as I have told in previous slide. So what will happen? So, when a person has a osteomyelitis, what will happen? The bacteria or fungus or any other germ may spread to the bone from infected skin. Either it can be spread due to the infected skin, or it can be spread due to muscles, or it can be due to tendon, which is next to the bone. This may occur under a skin sore. So these are this pros on how this can be occurred in a human body. Either it can be due to infected skin when we have a wound on the skin, or it can be due to the muscle injury, or it can be due to tendon injury. So the infection can start in another part of the body, and this can be spread to the bone through the blood. So this thing also can happen. For example, the disease is in the abdominal area, but the infection is such a high. If it travels to the blood circulation or lymphatic circulation, it might involve the bone in lower limb. So the infection can start in another part of the body, and it might spread to the bone through the blood. And this infection can also start after bone surgery. Now this is the main point. Majority of the cases what we are getting in nowadays clinical practice are infection caused due to the bone surgery. They do the bone surgery, fracture or something else, or dental surgery. When there is a contagious instrument is used while performing the surgery, then there is a chance of infection spread in the this blood circulation, and ultimately affecting the bone. This is more likely if surgery is done after an injury, or if metal rod or plates are placed in the bone in case of fracture of the major bone. In children, the long bones of the arms or legs are the mostly involved, and in adults, the feet, spine bones, that is vertebra, and pelvic bone are mostly commonly affected. So, what are the risk factors? So, these are the category of the people which they are more prone to get this kind of disease, that is osteomyelitis. One is diabetes. We all know immune response will be very low in diabetes. So person's body cannot fight with infection, and ultimately leading to the bone injury. Another one is hemodialysis. The patient who is on hemodialysis, the person who is having poor blood supply or any recent injury or wound cut marks, use of injected drugs, surgery involving bones, and weakened immune system. So these are the category of the people or category of the patient in which we can see more of this osteomyelitis. Okay, we have seen in modern science what is osteomyelitis briefly, how it spread and everything. Okay, so now main coming to the Ayurveda. Acharya Charaka and Sutrasthana in 17th chapter, he has given a definition of Vidrati. So Vidrati comes, this osteomyelitis comes under the Vidrati. So I have picked up this definition. So Drushta Raktatvat Ati Matratvat Sa Ve Shigram Vidahyate Tatah Shigra Vidahitvat Vidrati Tam Abhidhiyate. So excessive provoked Rakta Dhatu cause quick softening and formation of the pus. Owing to its quickly suppurating characteristic, it is called a Vidrati. So, simple definition. When Rakta Dhatu, we all know seven Dhatu, second one is Rakta Dhatu. When Rakta Dhatu is too much increased or too much Rakta Prakopa is there, so it will form the pus. And the pus is suppurating in nature. That is called Vidahi in Sanskrit. So the name is given, name for this disease is given as Vidradi. So Vidradi means Vidahi. Vidahi is there. There is a too much burning sensation is there in that part, and pus formation is there due to the Rakta Dhatu Pushti or vitiation of the Rakta Dhatu. And it is a nature of quickly suppurating. It is like pus forming, so it is called a Vidahi, with burning sensation. So the name of this disease is given as Vidrati. Simple. Now, interesting to note here that Acharya Charaka has counted as one among the seven Prameh Pidaka. When we read the seven types of Prameh Pidaka, the last one is this Vidradi, and Vidradi has also two types, Bahya Vidradi and Abhyanta Vidradi. So, this is the definition of Vidradi. The Rakta Dhatu or Rakta Dhatu, when too much increased, it will form a pus. And we all know Rakta Dhatu is a site of Pitta dosha. तत्र अस्थिनि स्थितो वायु पित्तम तु स्वेद रक्तयो श्लेष मेसु शेषेषा. So the Vayu dosha mainly resides in bone or Asti Dhatu. The Pitta dosha mainly resides in Rakta Dhatu, and the rest of the five Dhatu is the main site of Kapha dosha. So in this Rakta Dhatu is mainly involved. So by default, pitta will be vitiated. So there will be burning and pus formation. So it is called a Vidrati. So Rakta Dhatu is the main vitiated Dhatu in Vidrati that we should keep in our mind. And Pitta dosha is main involved dosha in the formation of the Vidrati. So these two things will help in tackling this case. Okay, so how exactly the pathogenesis or the samprapti of Vidrati happens in the bone? So त्वग् त्वग् रक्त मांस मेदांशी प्रदुष्य अस्ति समाश्रिता दोषः शोफं शने घोरः जनियुत चित्रता तृषं महामूलं रुद्रावन्तं वृत्तं च अव्यथायतं तम आहु विद्रधि धीरा विज्ञेयः च स षड्विद पृथक् दोषे हि समस्तेश्च क्षतेन अपृसृजा तथा Shanam api hi techam tu lakshanam sampraveksate. So this is the beautiful explanation Acharya has given on step by step how this disease really manifests inside our body. So when the person is consuming unwholesome ahar or unwholesome food and living unwholesome lifestyle or maybe sedentary lifestyle, there will be the prakopa of the dosha. There will be a vitiation of three dosha, mainly pitta specific case due to consuming bad food habit or bad lifestyle. So what happened when this dosha is getting aggravated or dosha prakopa is there, then it will find a place to lodge. So where it will get lodged, it will find its seat in the tvata, rakta, mas, even med dhatu. So it will vitiate this also. Once the dosha is getting vitiated, second step is it will further vitiate the tvata, that is a skin, rakta, that is a rakta dhatu, mas, evam med dhatu. After this, it will cause a astri ashrit shot. Astri ashrit shot means the swelling or the shot or kshoyathu which is residing in asthi dhatu. So asthi dhatu is also being told as mahamulam. See the slok I have highlighted the mahamulam in this yellow fonts. The mahamulam, when we read the commentary on this sloka, mahamul means asthi adi gambhir dhatu ashrit. So ras, rakt, mas, med. It won't occur, Vitradi won't occur in this four dhatu. It will occur in asthi and majja. So it is called as mahamulam. So it has a deep seated. So it is asthi adi gambhir ashritam. And this finally it will form the Vidrati. It will do the paka or it will cause a burning sensation over them and it will liquefy the bone and it will make a abscess from this bone. So Vidrati Samprapti, taking unwholesome food and living bad lifestyle will increase the dosha or it will vitiate the dosha. Vitiated dosha further will get lodged in the tvata, rakta, mas, evam med dhatu. Then it will cause the shoth. Shoth, that is a mahamul shoth. That is the asthi dhatu shoth. And it is called as Vidrati. So when we come to the Vidrati, we must have some doubt that what is the difference between Gulma and Vidrati. So Sushruta has beautifully given the difference between Gulma and Vidrati. He has given a slok. Now Vibandho Asti Gulma Nam. Okay, so Gulma and Vidrati, difference between Gulma and Vidrati, Sushruta has explained very beautifully. The No Vibandho Asti Gulma Nam, Vidrati is Sa Nibandhana, Gulma Akara Swayam Dosha, Vidrati Mas Shonit. Commenting on this particular sloka, the Dalhana has explained in depth about this sloka. So what is a Sa Nibandha and Anibandha? Nischanti Bandhana iti Nibandha Mulam. So here Bandhana is a connection or where the mass and rakta adi there will be together, then it is called a bandhan. So in Gulma there will be no bandhan. In Gulma there is a no connection between mass and rakta adi dusya. There will be only a dosha is vitiated in this. This is the main difference. In Gulma there is only vitiation of the dosha. Dosh prakopa will be there. But in Vidradi it is sarniban. Sarniban means it has a connection or the mass and rakta adi dusya are connected together, then it is forming the disease. That is called Vidradi. So main difference in between Gulma and Vidradi is Gulma will be anibandha. There won't be a involvement of mass and rakta adi dusya in the Gulma. And in Vidradi, along with the dosha vitiation, there will be a vitiation of mass and rakta dhatu. That is in Paka Avastha. So this is the main difference between Gulma and Vidradi. In Gulma, we cannot find Paka in any time, but in Vidradi, it is a must and compulsory. So it is called Vidradi, as we see in the first slide. So this is the difference between Gulma and Vidradi. Now, Asthigata Vidradi Lakshana, अतः मज्जा परिपाको घोर समुपजायते सो अस्थि मास निरोधेन द्वारं न लभते यदा ततः स व्याधिना तेन ज्वलनेव हृदयते अस्थि मज्जा उष्मण तेन श्रीयते दहत्य मानवतः विकारः शल्य भूतोऽयं क्लेश येद आतुरं चिरम् अस्थाया कर्मणां व्याधि द्वारं तु लभते यदा ततः मेदः प्रभं स्निग्धं शुक्लं शीतम् अथो गुरु भिन्ने अस्थिनः निस्त्रवते पूयं मेदद् अस्थिगतं विदुः विद्रति शास्त्रकुशलः सर्वदोष रुजापहम्. So how this vidradi occurring? After explaining Samprati, we have in-depth description. So due to the paka of marrow, as I told you, the rakta is getting vitiated and rakta dhatu is main site of pitta dosha. So by default there will be a paka formation. So but what paka of what? Asthi and majja dhatu or majja dhatu. As we see, this disease is happening in Gurumulam. That is asthi majja ashrit complete dhatu. So due to the paka of marrow or majja dhatu and due to the obstruction of bone and muscle. So inside there is a paka of majja dhatu, but outside there is a obstruction of bone and muscle. This paka cannot come out. And due to this paka, the burning sensation which is there in that specific part, it is not coming outside, but it is causing severe burning sensation in that area. The example is given like that. The too much of fire if there, then it will burn and destroy everything. For example, if a whole house is getting burning or if the house is burning, then everything will be lost or destroyed in that fire. Similar way, when this majra part is there and there is an obstruction of bone and muscle outside there, the person will get destroyed by this fire or paka. See, this much deadly disease the Acharya has mentioned in Soto 5000 year before. So this is the exact what osteomyelitis is that is being explained in this slope. Okay, now what happened when incision is made on this outer layer or asthi, the majjapaka comes out because it wasn't finding the way to come out. So it was causing a burning, and if it is not taken out that form, person may die. Like the fire will get destroyed in the fire, sorry, house will get destroyed in the fire. The same way, person will get destroyed due to the fire of this vidret. So when incision is made on outer side, this pus formation is there, which will come out, and it will be like a streak in color, guru, that is heaviness in nature, and this part of Majja Dhatu, which is called Asthi Vidradi. So very simple and clear cut definition our Acharya has given, which is 100% resemblance with osteomyelitis of modern science. There will be part of Majja Dhatu, but it will be covered with Asthi and Mas Dhatu. So the Paka will not come out. It wants to come out, but due to this covering of this, it won't come out. So it will cause burning inside only. It will cause such extensive burning that patient may die. So the person who is expert in cellular tikitsa or the surgery person has to make an incision outside and it has to drain out the pus. So this is the Asthi Vidradi Lakshan, osteomyelitis. Okay, so what are the treatment modality or what is the Chikitsa Sutra of this Asthi or Madhyajat Vidradi Chikitsa? It's applied to Asthi and Madhya Vidradi also. So Madhya Vidradi treatment. So first we have to do Asthi Vedan. So we must keep in mind that if it is a path with the Vidradi, then only we should do this Asthi Vedan. If it is in Am Avastha or Pachiman Avastha, we should never ever do the Asthi Vedan. So once we confirm that these are the Pak Avastha is obtained, so how to confirm it is a Pak Avastha or Am Avastha? For that we have to go to for Sushrut Samhita Vrana Adhyaya. In that Vrana, Am Vrana, Pachiman Vrana and Pakwa Vrana. So based on that symptoms, you can decide whether this is Pak or Am. So if Am is there, we should never do the Asthi Vedana. But once it is confirmed that this Vidradi is Paka or it's already Paka, then we should do Asti Vedana. Okay. So once the Asti Vedana is done, next we have to come here. So we have form a new one over there, or we have form a wound by making incision on that part. So we need to do the Vrana Chikitsa over there. So what we will do? We will do Vrana Shodhan, applying the medicine. We have to wash the wound with the medicine or the decoction which is prepared from Tiktaras Dravya. And we should also give Tiktaras Siddha Krutpan orally. Okay, so first we have made Asti Vedana we have done. After that wound is formed, so we have to treat the wound. For in wound, same treatment we do Pachalan with either we can do Panchavalkal Quath or we can use Panchtikta Quath or we can use Guruji this Gilo water also we can use. After doing that, Orally also we should give this Tiktaras Siddha ghee. Okay, so these two things we have done. So next is we have to do sandhan of this tissue. First, we have cut open the this abscess area. Then we have created a wound. So we have to clean that wound and we have to make this bacterial growth and whatever pathogen are there, we have to kill out. Okay, once the wound is getting cleared, now we have to adopt the treatments to heal that wound. So Acharya has explained Sandhaniya Dravya. Sandhana means it will close up the this wound. So use of Sandhani Dravya like Priyangu, Dhataki, Lodra, Katsal, all these are Sandhani Dravya that we have to do. Sorry, we have forget here. Before doing Asti Vedana, we should do Sneha, Sweda and Rakta Mokshana and then we have to go for Asti Vedana. So these are the treatment modality. From here we have to start. Snehan, Svedan we should first do. After doing this and after confirming it is a Pak Yukta Vidravadi, then only we should do Asti Vedana. Once Asti Vedana is done and wound is formed, then we have to do Vrana Chikitsa, that is Vrana Shodhan with Tikta Dravya Kvat, Prakshalan we can do, Evam Tikta Dravya Siddha, Gutpan we have to do. After wound is getting clear, we have to do the Sandhan Karma, so we have to use Sandhani Dravya like Priyangu, Lodra, Tataki, etc. So when अस्थि आश्रयण व्याधिनां पंचकर्माणि भेषजं बस्तीया क्षीरसर्पिषि तिक्तको उपहितानि च सरक सूत्रस्थान at 28th chapter where he explained the treatment of dhatu pradosha vikara. So whenever there is a asthi dhatu is involved in any kind of the disease, these two treatment modality we should use in treatment of this particular disease. One is panchakarma and second one is tikta dravya yukta ghee and milk. Either we should give panchtikta ghee for oral use or we can give matra basti which panchtikta ghee or classical karma yoga kal basti which contain the tikta ras dravya. So these are the basic principle on this approach we should treat this disease. Okay, so now I will be sharing two cases. First, in the previous earlier slide, I have mentioned that the chances are more nowadays. We get more cases due to the surgery. After surgery, due to complication of surgery, we get this kind of cases. So these are the first case of 43-year female patient. She came with severe complaint of severe upper palate swelling with bleeding gums, pus discharging from the swollen gums, foul smell, very foul smell, and she has lost the mobility of the teeth. That is a loosened teeth in affected part and heaviness of the face. That is a referred issue. Interesting to note that before 10 days of coming to our clinic, she had a history of teeth removal before 10 days. So this issue we can take as Abhigat as Vayu Prakopa. So there is a Vayu Prakopa due to external cause. What external cause? They have they have operated that area and Vayu is increased and it also reshaped the Pitta dosha and so all the pathogenesis started. Also, the patient was not a known case of diabetes or hypertension. Okay, so this area is the teeth, which is she removed before 10 days, and then she suddenly next morning she suddenly started developing this full thick and swollen gums. You can see this whole area. This is the same pitch, this mouth, but different angle, and this lateral side. You can see the large wound is getting from here. It is a full filled with pus and blood. So this area, it is exactly what our Acharya has mentioned. So this is the first visit when she came to us, 10 days of that surgery. And this is the latest image. See, this is the tooth removed, and you can see all the this side is become normal as this side. So there is 100% clinical improvement within 5 to 6 months of the treatment. Also important to note that in this patient, 100% Ayurvedic medicine were used. Nowhere in between we have used any antibiotic or any painkiller or any blood clotting agent. Only Ayurvedic medicine she has taken, and we can say 100% clinical improvement, and there is a radiological improvement also in this patient that we will be sharing later. So this is the CBCT scan of that report. The CBCT scan is usually advised in case of or when we need to study the health of the facial bone. When we need to study the facial bone or we want to see whether the bone is a good position or not, we advise CBCT scan. So The first when CBCT scan was done, there it was a left maxilla was having osteomyelitis and also the this teeth region. So here is osteomyelitis in left maxilla in 23rd 5 2022. This is the latest CBCT scan in January. Their osteomyelitis there only in limited region of the this teeth, and this osteomyelitis of left maxilla is 100% healed. So the left maxillary osteomyelitis healed completely without any operation or without any using of any modern medicine. So this is the beauty of Ayurveda. So what are our apart from this Asti Vidrati, we can either take this disease as we can treat as per Vish Chikitsa, we can also treat as per Asti front or wound form in Asti Dhatu. We can also take it as Asti Vidrati, that is the main topic for today. We can also take this as Mukhpaka. I am talking about previous case, the lady's case, or asthi kshay due to local vayu prakop due to previous injury. We all know that when there is a vayu prakop, asthi dhatu kshay will be there. Vice versa, when dhatu kshay is there, we have a vayu prakop. So this is pakka due to the previous surgery, vayu prakop was there. Asthi kshay due to vayu. So these are the treatment options that we have used in this patient. शुद्ध बल्लातक चूर्ण बिल्वादी गुलिका शुद्ध बल्लातक is semicarpus anacardium. Bilwadi gulika is a multi-herbal classical medicine. Serencotinine capsule is also contain this semicarpus anacardium only in it. Vyadhi Arandus, this is the main important medicine to treat any bone related disease. Triphala Gugulu, Panchtikta Ghee, Khadiradi Vati, Bhadra Mustadi Churna. So these all are medicine available in market. Bhadra Mustadi Churna, no company is preparing. The Vaishajya Ratnavali has the reference of Bhadra Mustadi Churna that we will be discussing in the next slide. Then I have used Sandhaniya Mahakashaya in tablet form, and also I have used Boni Hill tablet. Okay, so Shuddha Bhallathaka. So these are the fruit of semicarpus anacardium. This is also Rasayan and Vadikaran, and best to be used in this condition. So in this case, 2 to 4 pinch of oral dose were given to hold for a few minutes and then swallow it with the ghee. And we must keep in mind that before using Bhallathaka or semicarpus anacardium, we should keep in our mind that, or we should 100% confirm that there is no active bleeding inside the body. So in this patient also, we haven't started on initially this use of Bhallathaka. First, we have to stop the bleeding, or we have to make the pitta little bit down, and then we have to use this Bhallathaka. Otherwise, Vidrati is the Raktagata Vyadhi, and Rakta is the sthan of Pitta. In using Bhallathaka directly may elevate the condition. So this we should keep in mind. To reduce the Ushnata of this Bhallathaka, we advise them to swallow it with the Ghuta or cow ghee. This will do the counter effect, if any side effect. Then we have used Vilvadi Gulika. So what is the reason to use Vilvadi Gulika in this case? So lesion might be due to the adverse effect of material used in surgery. That might be anesthesia side effect or surgical instrument or other local medicine there used. So it fall under the Garvish. So we have used Vilvadi Gulika. Again, Serencotinine contain the semicarpus anacardium. This Nasya we have advised in this patient. It contains in the form of ghee capsule. We have to prick the capsule and we have to use the half of capsule in both nostrils. Vyadhi Arandus, it contains Shuddha Parad, Gandhak, Somal, Hartal, Mansil and Ras Karpur. Now this is the only one medicine in Ayurveda which is indicated in Asthi Dhatu Gatvish. This is the only formulation in Ayurveda indicated in Asthigat Vish. So clear cut this reference we have to use Vyadhi Arandras in case of bone and joints, or this when Visha is located in the Asthi Dhatu. So we have used this Vyadhi Arandras in this case. Triphala Gugulu we all know we use in Kapha Pradhan or Kleda Pradhan Kusta, and it is indicated in Bhagandar, Gulma, Shoth and Ursus. So this is the Triphala. This now Panchtikta ghee. We all know Asthi Dhatugat Pradosha Chikitsa Charaka has mentioned use of Tikta Rasa Dravya Siddha ghee for Asthi Dhatugat Vyadhi. So this is the Panch Tikta. This Guruchi is there, Vasa is there, Patola is there, Nimba is there. Then Khadiradi Vati, we all know for all the oral cavity disorder. Okay. Now, Bhadra Mustadi Churna, the reference is from Vaishajya Ratnavali Mukhrok Chikitsa under the this subchapter of Dantarok Chikitsa. Seven main ingredients, total seven ingredients: Musta, Haritaki, Shuji, Maricha, Pippali, Vinang, and Nimba. The falsity of this Bhadra Mustadi Churna is when there is a teeth mobility or there is a loosened teeth due to the weak palate, or when the bone hard palate is getting weak. So the teeth which is stick over there, it will also become loose and it will move. Sometimes it will fall down. So in this patient also, that all teeth were moving, or the teeth mobility this lady has lost. So we have used this Bhadra Mustadi Churna. I have used in form of toothpaste. She has to take this churna in her hand, and she has to brush her teeth twice a day with this churna. Now, the Acharya has mentioned use of the Sandhani Dravya. So, we have in the fourth or fifth chapter of the Sutra Sthana, Madhuka Madhu Parni, Ambastaki, Samanga, Mothra, Stataki, Lothra, Priyam, Katfal. These 10 herbs are being included under the this Sandhani Dasemani. So, the group of these 10 herbs are to be used when we need to do the Sandhana Karma, or when we need to bring something together inside our body. We should use this Sandhani Mahakashaya. We can set dose at 2 to 4 tablets thrice or twice a day based on the Rogi Bal and Rog Bal. So here Sandhani Mahakashaya, Sandhana Dravya means it doesn't simply applies to the fracture or the Sandhan Karma of bone. We need to do the Sandhan Karma. Everywhere we should use this Sandhani Mahakashaya. So Sandhan of those Dhatu and Mal. So we all know that definition of the health in Ayurveda is like that dos dhatu mala mulam hi shariram. So our body is made up of dos dhatu and mal. So when these three together is working on track, person is leading for a healthy life. When any one among these three is not working on track, or not working collectively, or not working togetherly, we have a disease. So in one aspect, we can also work on this. So when there is a critical condition, or patient is about to die, or very critical, and we don't know how what to do in such type of case, we just have to put this theory in mind. Those dhatu malamulam hi shariram. So just give Sandhani Mahakashaya in heavy dose. It will bring together those dhatu and mal, and it will try to force them to work collectively. So there might be a health improvement we can see in the patient. So this is the yukti we have to use like this. Sushruta advised use of Sandhani Mahakasha Dravya in Asti Madhyagat Vidradi. So we have used in this case. Other medicine to be used is Nimba Patra, because the Bhavpraka has mentioned Nimba as Nimba Patram Smutim Netram Kumi Pitta Visha Pranu. So Kumi, Pitt and Vish. So all these three are involved in osteomyelitis. Now how we can give this, or how we can advise this to a patient. So chewing neem patra for 10 to 15 minutes twice or thrice a day helps in the mobility of the teeth. Or we can also use different modality as kavala, or we can use bandusha, or with the fresh juice of this leaf. So any patient where we see the teeth mobility is lost, or the tooth is moving, or socket is becoming weak, with simply using of this neem patra, they ask patient to advise 10 to 15 leaves of this nimba in twice or thrice a day. We can definitely see improvement in teeth mobility in 7 to 10 days. We can also use Vibhitaki Falpa for chewing purpose when there is a excessive salivation. Here again, Ati Lala Srav or Praseka is the symptoms of cough prakopa. So such patients who have oral osteomyelitis or maxillary bone hard palate, they complain at too much salivation. They have to keep this napkin with them, and they have to wipe out the saliva. So in that case, we can advise the chewing of this Vibhitaki Falpot. It is a best clay nashak. Keshar Gugulu can be also used as Falsutis, Pramepidika and Sarvavran. Pramepidika is one among the Vidradi in according to this Acharya Charaka. So these are the case study. This is the CBCT scan report. Here, this photo you can see. These are the black mark over there. There is a lost bone is lost over this area. So the rays are passing through it easily. So this area is showing a black mark. This yellow color is there. That is showing that it is a healthy bone is there here. But in between here, you can see there is a black mark that shows that there is a no bone in there, but the bone is lost due to osteomyelitis and necrosis due to osteomyelitis. Okay, after giving the treatment, here you can see clearly the new bone is getting formed here. So this thing, the modern science people will never believe that without operation or with medicine, how the bone is getting formed. But we have the evidence in the CBCT scan report. There, here is the new bone getting formed here. You can see. You can also see the upper palate behind the teeth. There is a around 1 centimeter of bone is lost here. It should be a yellow color or white color in CBCT scan, but it is showing black. That is showing the bone here is getting got lost due to the necrosis or osteomyelitis. So now you see this photo and you come to this photo. You see almost 90% bone is again regenerated in this area due to with use of Ayurvedic medicine. Here also you can see the black area is showing the lost bone. After taking our Ayurvedic treatment, we can see the clear boundary, the bone is getting formed. So this area also we can see the bone is formed, which is clearly visible to everyone. This no bone here, here it is bone formed. Here also behind the teeth there is a lost bone. Here it is getting formed. So this is the one case. This is the case of that ladies which removed the teeth 10 days back and then came to us. In that we have this. See, this teeth you can see here, the removed teeth is not showing in CBCT scan. But due to this, osteomyelitis occurred in whole palate and we have almost healed this area. So these are the second case of osteomyelitis of facial bone. That also we have treated with same protocol, all the medicine were given. So EA photo you see, behind the teeth, there is a no bone is lost here. See, you can see there is a no bone here. Black mark is here. This is in 14/6/2021, and now we see in 6 months after our treatment, we can see a complete 100% healthy bone is getting formed here. You see how much this damage is there here. There is no bone here. And after 6 months of treatment, you can clearly see there is a healthy and new bone is getting formed here. So same in this photo behind this teeth, this front middle teeth, there is a no bone behind the teeth. You can see the black mark behind the teeth. And now in this is after 3 months of treatment. This is after 3 months of treatment. This is after 6 months of treatment. So after just 3 months of treatment, the new bone was getting formed behind the teeth. And here also you can see. So these are the evidence which nobody should reject on when this helps to build a more and more stronger confidence in our Ayurveda that this kind of disease can be easily manageable and we can have evidence also to show anybody that the bone can get newly formed with Ayurvedic medicine. It takes 3 to 6 months. But it happens. We should not come in a superiority complex of modern science. Instead of that, we should respect our Samhita and Shastra. This case proves that our Samhita has answer for each and every disease of past, present, and future. Let it be any disease come. We must have solution in our Ayurveda. Thank you. Thank you.
Dr. Rajnikant, Bhallathaka use, so a lot of doctors don't use Bhallathaka in their clinical practice
Yes, sir.
because the prescribed methodology in the Shastras needs a tedious work for Bhallathaka Shodhana and it goes, and also the test to know whether Bhallathaka has been properly subject to Shodhana or not. So this always remains as a debate in the mind of the practitioners. Use of Bhallathaka very difficult. You used Bhallathaka and also you have said that it is given for, of course, after Shodhana for to be kept in that particular place of osteomyelitis. Saranpatanai, which also has Bhallathaka as a active ingredient, it has been used. I'll come to the Nasya part. It was very interesting later. But how courageous it is to use Bhallathaka, and what are your tips for the clinical practitioners? How easily we can bring Bhallathaka into the use in Astividradi and also in other cases? Where else do you use Bhallathaka? and what precautions we need to take, how to know that Bhallathaka is purified in a proper way.
See, our Acharya has never mentioned that Bhallathaka should be used with careful. They have mentioned is like how they mention Guruchi or how Acharya Charaka has mentioned Haritaki and Amlaki. In the similar way, he has mentioned use of Bhallathaka and Rasayanadhyaya. So why to fear? Fear, we should not have a fear while using Bhallathaka. Once we keep on using Bhallathaka, our fear will go. We use Bhallathaka in it's a pediatric patient also. No doubt. When sometimes when proper purification is not happened with that medicine, we may face some little bit pitta aggravated symptoms. That we should know the antidote giving coconut water or too much coconut or coconut oil application like that. But I rarely found the complication of usage of Bhallathaka. Never. So rarely, 2-3 patient maybe.
So, but you use Bhallathaka adequately. So, in most
Yes,
of
I
your
use too
cases,
much.
yeah.
Too much Bhallathaka.
Okay. Other than this, where do you use Bhallathaka, and what are the contraindications? Like, you have noticed? Have you noticed any reactions or something?
Contraindication is first the platelet count. Where the normal platelet is there, we go. Where there is a low platelet, 1 lakh, below 1 lakh, it won't happen anything. But in case the bleeding is started anywhere due to Bhallathaka, then it will be difficult to arrange the hemostasis over that area. So one is that platelet. Second one is for initial 4 to 5 days, we give the little bit dose, or we give taste dose. Maybe one pinch twice a day for 2 to 3 days. We give to the patient, and we tell the patient to observe 2 to 3 symptoms. If after consuming this medicine, if you have bleeding in stool or bleeding in urine, if you have itching over anal area, or if you have itching all over the body, just not come and report to us. So we explain before only to patient. Most of the patients don't have any issue. Rarely we find this. There is a active bleeding in this case. Any case. In this case also, initially we haven't used Bhallathaka because there was a bleeding from the gum. So once Pitta Shamana Chikitsa give, we balance little bit Pitta, then only we should give the this Bhallathaka.
Okay. Thank you, Dr.
Always give
Raghuram.
with Gurukula. We should always give with cow ghee just to counter if it's any adverse effect.
Do you mix it in Gogruta, or ask the patient to have like some
No,
kavada of
just give churna and they have to mix with this cow ghee and they.
So that's so nice of using.
For ovarian cancer, we give for rubbing there. Take a pinch and rub on this cancer site on oral tissue. There it will be the bleeding, but we give because we need to take out that this vitiated dosha.
And coming to another interesting point you made, Serenpattanai, so which also has Bhallathaka, was used as Nasya. What is the logic behind using Bhallathaka in the form of Nasya in that, and Nasya especially in this condition?
One point is that, and it is a Urdhva Jatrugat Roga, means every disease of head will come under Urdhva Jatrugat Roga, and it is a major site of cough dosh. So, also when oral cavity is affected, no doubt somewhere there will be a cough disturbance because it is the main site of the cough dosh. When we see Pakwasha is for this Vayu, head is for cough. To balance the cough, and also when there is a Shota is there, or due to some avran is there, when the disease is caused due to the avran, where we use this Bhallathaka. In mucormycosis case also, we have used the Nasya of this Bhallathaka ghee.
Okay.
The Serenpattai contain this ghee and butter and this Bhallathaka.
And strategically, you have used so many medications, like a sequence of medications you have listed, and each medication you have explained why it needs to be used. So in this particular case, was it a strategical chronology of use, like we should use this and later we should use this? So these medicines were used over a period of time, or all medicines were given together and asked to continue?
No, not together, because you see here.
So if you can highlight, where exactly, in which condition they were used.
See, Vyadhiharan Ras is, Vyadhiharan Ras is contain Hartal and Mansila, that is arsenic compound. So the same precaution applies for Vyadhiharan Ras and also for Sutta Bhallathaka. So when there is a high pitta is there or there is active bleeding, we should remove this from prescription. Number one and number four. Okay. When the patient initially came, we have started with Triphala Bugulu, Panstikta Ghee, Khabiradi Vati, Bhadra Mustadi Churna, and Sandhani Mahakashaya. Once the redness over the gum is getting reduced, burning sensation, patient is complaining, it is getting reduced, then only we have to add Vyadhi and Ras and Shuddha, this Bhallathaka Churna. Vilvadi also, in some patient, it may aggravate Pitta dosha.
So
So,
to
not
administer
all
to
together,
administer
no, no.
yeah, no, to administer Vyadhiharan Rasa and Vilvadi Gulika and Shuddha Bhallataka, you wait for some changes to happen there and then you bring it into second schedule.
Vivadi Gulika Vyadhiharan we can use, but Shuddha Bhallataka 101%. Once there is a pitta come down and no bleeding, everything is confirmed, then only I use Bhallataka. Vyadhiharan and Vilvadi also same, but we can use if condition requires, patient needs, then we can give.
Which among these medications you have kept it for long-term use, still complete healing?
See, Sandhani Mahakashaya and Panchtikta ghee, I think she is taking now also more than 8 to 9 months. Panchtikta ghee and Bhadra Mustadi Churna, now she is taking this Dasan Sanskar, but same, Sandhani Mahakashaya.
Right.
Bone meal also we have removed from prescription. Because bone is getting formed with Panchtikta ghee and Sandhani Mahakashaya.
Sir, I want to know that you have used here Shuddha Bhallathaka Churna. What about the things which are explained in Rasayana Kalpa as you said, Bhallathaka Rasayana is explained around 11 Bhallathaka Rasayanas are explained. Those also we can able to use in this in this condition, sir?
Yes, we can definitely use Bhallathaka, Sarpi is there, Bhallathaka, all the yoga which is mentioned in
Guda, Bhallathaka Kshira, Bhallathaka.
yes, we can use. Because there only Acharya Charaka has explained that no Asti Roga, something like Shloka is there. There is no kapha dosha in the world which cannot be treated with this Bhallathaka. So we can use any form of Bhallathaka. Amrut,
Yes, sir.
we can use healing everywhere.
In all types of autoimmune diseases also we can able to use this Bhallathaka.
Sorry, which type of disease?
In autoimmune disorders, we can able to use Bhallathaka majorly because Amrita Pasha Bhallathaka Grata is there.
We can use.
Thank you.
Thank you.
So coming back to this, so that was good as you mentioned it. These medicines were used in a strategic way. Sandhaniya Mahakashaya was an interesting medication there. As you rightly pointed out, like one of your interpretations, like if Sandhana Mahakashaya is given, it should be thought more than what is Sandhana bringing together. So like it can bring in coordination of the functioning of dosha, dhatu and mala together and establish health. Okay.
Yes.
So other than osteomyelitis, if I am using Sandhaniya Mahakashaya, is it always wise to bring in Sandhaniya Mahakashaya after a course of Shodhana?
We don't advise Shodhana for using this. We can give directly with some means on the principle of Samanousati we can give.
No, see, in apart from other than this osteomyelitis case, my question is,
Asking.
yeah, everybody will be interested to know if we want to implement Sandhaniya Mahakashaya. So, like as you said, according to your hypothesis, dosha, dhatu, mala, integrity and their integral functions will be established by using this particular Kashaya. So that was a nice observation by you. My question is, in that case, directly when you are using Sandhaniya Mahakashaya in some other condition X, we don't know, but you want to use it there. There you would like to assess the Sama Niramata for the doshas and also how much dosha aggravation is there, try to settle it down and also create a suitable environment for Mahakashaya, Sandhaniya Mahakashaya to act, or as such you are going to give it?
No, majority of the disease was they don't have time to do the Sama, Nirama, those parts and different. The patient which require, for example, Amva patient is coming, then we definitely give Langan, different parts and everything. This kind of, this lady came for after 10 days of removing this teeth and came for this. If we wait for 7 days to do Am Pachana or to make a Nirama Avastha, then this damage will be more.
In other conditions, I am telling. So,
in condition, definitely. For example, Ama is there in there, then we give Musta Siddha Jal or Sunti Siddha Jal. Agni is there, then we give Dipan Pachan Ausati, definitely we give. And we use this in ulcerative colitis also, we use in the lower, this loose motion also, we can also use in infertility, where we need to do Santan of sperm and ovum. Every report is coming normal, but conceive couple is not getting conceived.
Hmm.
So we must try Sandhani Dravya. Recently, we have shared one case of aortic dissection. The major aorta coming out from the heart, this aorta getting tear, and the whole blood is accumulated in that. So in that case, we have used this Sandhani Mahakashaya to repair the teared layer of this aorta, and I got the results.
So the words which have been used in the context of Ayurveda should be seen with an elaborative perspective, like Sandhana is equal to joining or joining. We should not see that. We should go beyond that particular point and read between the lines and between the words and try to understand where exactly these can be used. Only then we can bring them intellectually into the clinical practice. So that was a wise take in it.
Everything is about applying it. Yes.
Absolutely. Understanding. So deeper understanding and deeper understanding. So both those things will differ. So, okay. So you've used, so generally a physician would tempted to treat these conditions. So because see where the lesion is in the mouth. So generally the Ayurveda physician may be tempted to not go into the depth. So we may even ignore the reports and other things and just treat it as a Mukhagata Vyadhi, like oral conditions, without bringing this big Vyadhihara Rasayana and also the Bhallathaka or Vilvadi. So without getting them, so a physician just would casually look into the oral cavity, which is not healing, and they may come up with some Kavala, Gandusha, Triphala, Gugulu, etc., and simple medications and try to heal this condition. So will they be enough in the initial conditions, or should the physician consider the deep investigations? What is the role of getting investigations here, the radiology done and seeing through the radiological features, as you have before treatment and after treatment records for this particular case and other cases also? How good is it to go into the depth? So as I said, general purview is the doctor looking at this as a Mukhagata Vyadhi and going up with the treatment prescribed in the Mukhagata Vyadhi.
Definitely, when we use the primary set of medicine, like not going for Ras Aushadhi or this Bhallathaka and everything, when we use all simple Mukhroga, let it be Keshwar Gukur, Triphala Gukur or some little Pachana, definitely there will be an improvement in the swelling, there will be a little bit burning sensation will be come down, but the Asthi Dhatuka twist, the osteomyelitis is not a simple bone disease. It is if it is not getting controlled, the whole skull bone can get involved in osteomyelitis. Later, if this case not treated for 6 to 8 months, the osteomyelitis in the maxillary sinus bone or upper palate bone may spread to the skull base osteomyelitis that we observed in many patients of the mucormycosis. Once the skull base osteomyelitis happened, there is no treatment in the world in Ayurveda. There is no treatment. Even in Ayurveda also it is next to impossible to manage that case. That is a skull base osteomyelitis, and patient will have a lifetime this neck pain and heaviness over there, burning over there. So initial symptoms will be covered when we use primary set of medicine. But the bone which is got lost over that area, that we need to form the new one. Otherwise, if it is spreading more and more osteomyelitis, once skull bone is getting involved, then it is very difficult.
So here it is very important to look at the Samprapti Gatakas rather than going with Lakshanas. Very important. So, and going deep and
They self mentioned, it is the Madhavbaug, and due to the Asthi and Mas Dhatu obstruction, the pus is not getting coming out. Pus is not able to come out. When it is not coming out, once it is staying inside, it will further damage the deeper area.
We have come to the conclusion of the session. So thanks, Dr. Rajnikant, for your wonderful presentation.
Thank you. Thank you, everyone.
Thank you and namaste.
Thank you.
Thank you.